We studied today. So, we've studied headache. The basic definition of headache by the International Headache Society is defines as pain located above the orbitometal line. Now, anatomically, if you want to find the orbitometal line, just put a pen, orbit and meatus. It's that line. Anything above this is considered headache by International Headache Society. Includes migraine, cluster headache, subarachnoidal hemorrhage, hypertonic crisis, meningitis, encephalopathy, and acute sinusitis. Now, there's guidelines to manage this. So you have to basically establish a partnership with the patient to manage it acutely because he might have underlying problems, and then develop a pharmacological plan and treatment strategies. Treatment plan, there's like various, like we discussed today, cognitive therapy, regular sleep, exercise. Okay, for anything, any headache, these are the migraine triggers. So basically we suffer from, we abuse most of them. Like lack of sleep, jet lag, stress, caffeine, hunger, alcohol, smell, medication, light, sound, hormones, change in weather, physical activity, or food. Okay. Strategies for any type of headache is basically three types. Acute treatment to stop the pain and prevent further progress is during the pain. Preventive is basically prophylaxis to prevent further episodes, and preemptive. Like, let's say a person is doing physical activity, he or she can be expected to get a headache, so you can deal with this before. Okay, the medications. There's an easier way I found out to learn all this. The short form is called Conan is ET, like Conan the Barbarian, because C stands for combination analgesics, O stands for opioids, N stands for NSAIDs, A stands for antimemetics, and N is for neuroleptics, and these are non-specific, that's used in all kinds of headaches. Specific is ET, that stands for ergotamine, DHE, or triptans. Now, there's a treatment algorithm for any headache. There's diagnosis, initial treatment, use optimum dose, correct formulation, underlying disease treatment, follow-up, change of the drug if necessary, and patient satisfaction. Like, you should be able to prevent the headache, not just like give anything. Now, drugs, like I said, specific and non-specific, we studied. Mechanism of drug action is basically what we studied today, so I'm not going to go on that. Okay, my personal choice and whatever we use mostly in acute is triptans, like sumotriptan, zolmitriptan, aratriptan. There's lots of names, so whichever is the drug of choice in whichever country. Now, there's good and bad with respect to triptans. The good is it's selective 5-HT agonist. If you study the mechanism of migraine, you'll know what 5-HT is. It's basically the trigeminal vascular system. It works fast. It has high efficiency. Side effects. It's low side effect. Bad, as we studied, it's Prince metal angina, angina pectoris, diabetes, obesity, hypertension is uncontrolled, and pregnancy. We never subscribe to these kind of patients. Routes, it's oral. Most of the medications are oral. Nasal sprays is sumatriptan, DHE, zolmitriptan. Injectables also sumatriptan, DHE, opioids. Injectable NSAIDs, neuroleptics. Suppositories are ergots and opioids. Now, class of patients, there are three classes. Like we can give them, like let's say pediatric or adolescent, if the patients are young, give them NSAIDs, triptans, and behavioral therapy like sleep, exercise. We don't like prescribe more drugs to them. Elderly is acetaminophen, opioids are typical neuroleptics. Pregnant women, corticosteroids, neuroleptics, and acetaminophen. Okay, now that day we heard something about Alice in Wonderland syndrome. Since I read the book, so I found it interesting. It's okay. If anyone's read the book Alice in Wonderland, has anyone read the book? Okay. In the book, there's a little girl who thinks that she's gone down the rabbit hole, and it is named because of the fact that it's seen more in young women, like young females. You see like a set of alteration of body image. Like let's say you feel like you're in a big room and you're like really huge. It's like hallucinations, but it's like severe hallucination. Welcome back. An alteration of visual perception is found, especially in the size of body parts or external objects. Like you'll suddenly feel your hands are very big or your legs are very big. It's typical migraine, temporal lobe epilepsy, brain tumors, psychoactive drugs of Epstein-Barr virus infections are causes of AIWS. There's no specific cause, It can be one of these few like cases study, like very few cases have come up with this. It has no effective treatment. The treatment plan consists of migraine prophylaxis and migraine diet, like anticonvulsants, antidepressants, calcium channel blockers, and beta blockers. But usually we like prefer a migraine diet regime because I literally like small kids. Chronic cases also exist. Like there's a child I read who she was presented with the case at the age of 6, and she suffered at the age of 13. So it's chronic, like for so many years she suffered, and then suddenly just vanished. There was no case. Okay, magnetic imaging MRI is negative. Epstein-Barr virus and serological testing can be found, like you can find this. And other pathogen and EEG also it's clear. So basically it's just like a severe form of hallucination in kids, especially young females, you can presume so. So yeah, put a nice picture of Alice.
What is this picture from?
Of Alice in Wonderland, the movie.
Oh, it's nice. I want to be there.
You will be hallucinating there.
Become a girl.
And the author of the book suffers from migraine by himself. That's why he described all the symptoms that he has in his life. The last thing for you.